Hello, I'm Jo Anyon. I'm part of the new hospital project team. I've been a nurse for 20 years and we're here today to show Hayley around the 32-bedded inpatient area of the new hospital. Hi Hayley.
Hi, Jo.
This is Hayley Hughes. She's a ward manager in neurology at Southmead Hospital. What do you think of it so far?
I think it looks amazing. What's this bit?
This is the clinical workstation and ward reception for a 32-bedded area.
Immediately when I saw it and now I know what it is, I think it's fantastic. It's like an open plan kitchen in a restaurant, which I really like to be able to see what people are doing.
I always think when we're in quite small clinical rooms, you sort of have to elbow each other out the way to get to do your IV drugs. But you've got so much space here. So this is a pneumatic tube.
Right.
There's one per 32-bedded inpatient area, and it collects directly to pathology over in the new pathology building. You'll have cupboards both sides, and then between the two you'll have task lighting for drug preparation. Got loads of working space here. I think that's always a problem at the moment. And then as you can see, fantastic views out the end. Real lovely natural light coming in. It'll give you a real lift when you're working here.
It is amazing.
So this is the nurse call panel. There's one of these for every 32-bedded area, and it's in the same place in every area,
Right.
so you'll always know where to look for it. This will show all the buzzers that go off on the ward. It'll show where they are, and it'll also show them as a priority. You'll be able to turn it off at the panel, and then you'll be able to follow the lights up the corridor to find out where it is. So this is the procedure room. There's one of these for every 32-bedded inpatient area. And the idea is that more invasive procedures would be able to be done in this environment.
So I'm sort of thinking of, as in neurology, we do a lot of things like lumbar punctures and muscle biopsies on the patients, and this would be a fantastic area for that.
You've got all the appropriate bed heads, so you've got oxygen and suction in here. You've got a scrub trough, and you've got a workbench, and there's plenty of space for people to move around. So each 32-bedded inpatient area has got 24 single bedrooms and 2 4-bedded bays.
And that's been quite a concern for a lot of my colleagues, being able to see the patients, the visibility of the patients in the single rooms.
But I think once you're standing here, you can see that the rooms are designed in clusters of 4. And when you stand in the centre, you can really see right into each room from here.
I mean, it's almost like being on a Nightingale ward, actually, where you can see your patients on either side. It's really open and, you know, it's quite reassuring, actually, how visible the patients will be.
Also, in between each pair of rooms, there's a perch, which is standing height. And this is designed that if you've got patients in these rooms that maybe need a bit more observation, you'll be able to stand here and you can finish your paperwork or complete your Cerner assessments, whatever you need to do, but also maintain your visibility as well. Obviously, you can shut the doors. And you can see when the doors are shut, they're really big doors. It gives a real sense of space. But also you can see down here and in the centre of the door, you've got really large visibility panels.
Yeah.
If necessary, you'll be able to close the door for infectious patients. You've got the blinds and the doors to provide privacy and dignity. There's so many studies that show that a good night's sleep is so beneficial towards a patient getting better. And I think when you're in a single room and you are able to close the doors at night, just being able to get that good night's sleep without hearing the nurses walking up and down. Then there's also the other important issue about being able to separate the genders really easily, other than we do at the moment, which sometimes creates bed problems because you've got a male that needs to go in a female ward. So we can do that naturally here with the inpatient rooms. So this is one of the single rooms. As you can see, they're quite big. You've got a clinical hand wash basin, which is to encourage people to wash their hands before and after they go to the patient. You've got floor-to-ceiling windows. There's a lot of evidence to show that to promote people's psychological and emotional well-being, it's really important to have contact with natural light. You'll notice that we've got a door that can be opened, which will allow a real breath of fresh air in. You've got plenty of power points. The 2 bottom power points there are designed to be for the bed and mattress.
Right, okay.
So you've always got somewhere to plug the bed and mattress in, and you also don't get it confused with clinical equipment. You've got the smart wall there, which is where all the services will be. You know, at the moment you end up sort of contorting yourself into all sorts of positions to get to the oxygen point or power point or something like that. You won't have to do that there. You'll always be able to access those services really easily. Ensuite toilet and bathroom for every patient in the single bedded rooms.
And I noticed the hoist overhead.
Yeah.
We've got one of those in every single room.
Yeah, we've got one in every single room. I think that's a real bonus, having a hoist in every room. So this is the 4-bedded bay. As you can see, the layout of the bed space is the same as a single room. Each 4-bedded area has got an ensuite shower, toilet and hand wash basin. The hoist has got a higher weight limit on it than the single rooms, although they're both still quite high. These areas will probably be used for patients that need more higher observation. So the sick patients, or for example in neurology, you'll have the patients that are maybe a bit more confused. When you think of it compared to the 4-bedded bays that we've got at the moment, there's such a big space. The bed space, when you've got the curtains in, the bed space is really huge. You've got a really good amount of space to work around. So this is one of the quiet rooms in the hospital, which will be used as a social area.
We've got a social area and it's really well used, and I was quite concerned there wouldn't be anything like this for patients.
This is one of my favourite rooms in the hospital.
The window is amazing.
I think this will be a really well-used space. So this is the staff-only area in between the two 32-bedded areas.
So patients visitors won't be able to come in here at all then?
No, these doors have got access control on them, so you'll only be able to get in there with your swipe card. It's also an important part of the design of the hospital for us to be flexible. So, for example, in winter, when respiratory might need more beds, the design will be that they can take over maybe 8 beds of the next 32-bedded area.
So that would reduce the risk of patients outlying in the wrong speciality, so that's much better for patients, really.
So this is the communal staff room. This is shared between the two 32-bedded areas. So again, they've got loads of natural light and space. Yeah. There'll be a water boiler, so you won't have to wait for the kettle to boil when you want a quick cup of coffee. There'll be a fridge and a microwave and some cupboard storage as well. So this is one of the mock-ups of the single rooms in the new hospital. We've produced these really to give people a much better idea of how the room will look when it's actually up and working with all the equipment in. We've got the vision panels down the door and to the side, and in this one the blinds are working. So you can see that when they're open, there's really quite good visibility through. So you can only operate these from the inside, so that you can't someone coming along being nosy and twiddling them from the outside when your patient's trying to get undressed in here. We've got the built-in wardrobe. There's 3 shelves in there and a clothes rail. And then I think you can see with the bed in here, really how the smart wall and the sockets work. That they're not behind the bed, you don't have to reach over to get them. With all the lights in place, it's quite bright. And we've designed it really carefully so that if you're bending over, you don't get a shadow on the bed. So the other thing that we've got in here in a bit more detail is the ensuite bathroom. The floor slopes gradually down towards the shower, and there's a drain in the end in the real thing. But you won't have a shower tray for people to trip over. And the slope is so gradual that you don't trip over the slope as you walk up it. The toilet seat provides correct contrast for people with visual difficulties to make sure that they can see the difference between the toilet and the seat. The tap and the sink, the way they're aligned means that you don't get splash back here. And then the tap, we've tested with people with rheumatoid arthritis, and they really like it because you can use your fist and hand quite easily to move it. So this is a mock-up of the procedure room. So you can see that you've got plenty of space either side. You can really tell with all the equipment in it how much space you've got to perform your procedures, and you've got the bed heads up there as well. This is the 4-bedded mock-up space. As you can see, the setup for the bed spaces is exactly the same as the single rooms. You can get a real sense of how much bigger the bed spaces are than what we're used to at the moment. So we've been round the hospital and the mock-ups. What do you think of it then?
Well, I think it gave me a real insight into the new hospital. It really reassured me. We obviously all have a lot of concerns, but this has been a real eye-opener, and I'm really pleased to have been able to come round and look at it.
Well, thanks for coming round, Hayley.
Thanks for taking me round.
Oh, I was really pleased to show someone else the hospital. I hope you've enjoyed our video of the new hospital and it's inspired you to find out more about it before it's opening in spring 2014. If you'd like to find out some more about the new features, why not visit our website at nbt.nhs.uk/newhospital.